So today we will discuss about the essential concepts of drugs. Essential, so we can call it essential drug concept. As well as we will discuss about route of administrations, various route of administrations. We will discuss later. So first we will discuss about the essential drug concept. So these are the drugs which satisfy priority health needs, and they are selected for efficacy, safety and cost effectiveness. And these should be available, as well as affordable in suitable forms. And WHO model, they list a guide for national list, and they are divided into core and core as well as core and complementary list. Core and complementary list. These are the key to universal health coverage, and they are adopted by over 150 countries. So 100, more than 150 countries, they have adopted this essential drug list. So the essential drugs, these are those drugs that satisfy the priority health and the care needs of the population. And they are selected with a careful consideration of public health relevance, evidence of efficacy and safety, and comparative cost effectiveness. So what are the key features of these essential drug lists? They should be available at all times in the adequate amount. They should be available in all time. They should be available in all time, and in the adequate amounts, and in appropriate doses forms at affordable price. They should be available at all times in adequate amount, in appropriate doses forms, and at affordable prices. And WHO, they publish this model list of essential drugs every 2 years. Every 2 years they publish this drug list, which guide the countries in developing their own national list. And this concept aims to improve the access, rational use and affordability of medicines globally. And the list is divided into two different parts. One is this core and the complementary. The core list, these are the minimum medicines needs for the basic healthcare. And the complementary list, these are for priority diseases requiring specialized care. And more than 150 countries, it is quite important to remember that over 150 countries have adopted national essential medicine list based on the WHO model. And the essential medicine concepts is quite key to achieving this universal health coverage, and is fundamental component of primary health care. Next we will look at the various routes of various routes of administration of drug. What are the various routes of administration of drugs? First is oral route. So in the oral route, the drug is taken by mouth and absorbed via the digestive system. For example, tablet, or it may be in the form of syrup. Then we have sublingual or even the buccal route. In this route of administration, the drugs are placed under the tongue or in the cheek pouch for rapid absorption. For example, nitroglycerin. Then we have rectal. In the rectal, the drug is administered via the rectum. For example, suppositories for local or systemic effects. Then we have parenteral. In this, the drug is injected directly into the body by bypassing the gastrointestinal tract. And in the parenteral, we may have like intravenous IV, we call it IV, or intramuscular or IM, or even subcutaneous SC. So this intravenous route of administration, the drug directly goes into vein for immediate effect, for example antibiotics or even fluids. And the intramuscular, the drug goes into muscle, for example vaccines or even some antibiotics. And the subcutaneous drug, they directly into the tissue beneath the skin, for example insulin. And then we have another route of administration, that is inhalation. And in this route of administration, drug is inhaled into the lungs, example asthma inhalers or even anesthetic gases. Then we have topical. In the topical route of administration, the drug is applied to the skin or mucous membranes for local effect. For example, creams or even ointments. And then we have transdermal route of administration. Wait, let me first delete this whole thing. So we have the transdermal route of administration. I'll write it transdermal route of administration. The drug is delivered through the skin via patches for systemic effect, for example nicotine patch. And then there are some other categories. For example, we take it as nasal, through nasal route, for example decongestant sprays, or even eye route like ocular, we call it ocular. The drug is administered via eye, for example eye drops, or even otic route of administration, that is through ear, for example ear drops, otic. So I hope you understood. So quickly, if we summarize the route of administration, there are oral, sublingual, rectal, parental. In the parental we have three different types: intravenous, intramuscular, IM, and subcutaneous SC. And then we have inhalation system, and then topical or even transdermal. And then there are other routes. For example, we have ocular, or even otic. Ocular means through the eyes, and otic means through the ear. I hope you understand. Thank you.